Finally retired and looking forward to traveling? Let's talk about how to navigate Medicare while traveling domestically and abroad. Hi there, as always, if you have questions about your Medicare coverage or health insurance in general, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there is, of course, no charge for our services. And don't forget to like and subscribe. Navigating Medicare while traveling is impacted by whether you have Original Medicare alone, Original Medicare plus a Medicare Supplement plan, or a Medicare Advantage. We're going to talk about all of these different options, whether you're traveling domestically or internationally in today's video. Also, as a side note, if you are traveling and you have Part D, try to make sure you can get a 90-day prescription when available. If you're traveling domestically, you can probably fill your prescription at any chain pharmacy, but it's best to get a 90-day supply to avoid any potential hiccups. Original Medicare is divided into Part A, which is your hospital insurance, and Part B, which is basically any time you see a doctor. Together, they're going to cover most of your medical needs. Now, one of the great things about Original Medicare is that there are no networks, and almost 98% of doctors accept Original Medicare. So it's very, very easy, even when traveling domestically, to find a doctor, a specialist, a hospital who accepts Medicare. And remember, with Original Medicare, you don't need a PCP, which is a primary care physician, or referrals to see a specialist. So again, navigating your health coverage while traveling domestically with Original Medicare is very easy. Traveling abroad is an entirely different story because Original Medicare really doesn't cover you outside of the United States. So what are your options? First, make sure you check with your credit card company. Some may offer some type of medical travel benefits, but definitely take a look at those terms and don't just take the fact that it offers travel insurance for granted. Make sure you understand exactly what the extent of those benefits offered are. Now, if you're traveling abroad, you have the choice between short-term medical insurance and long-term medical insurance. Let's discuss both options. So of course, short-term travel medical insurance is going to be for a shorter term. This is for your average traveler. Now, because it's for short-term vacations, it's really only going to cover medical emergencies. For example, such things as emergency medical expenses like a broken bone needing x-rays, or emergency dental like a chipped tooth, medical evacuation like if you needed to be airlifted, or even accidental death or dismemberment. Now, you can choose between comprehensive travel insurance or just a travel medical plan. You can even get multi-trip coverage. If you're going to be away long-term, then you'll need a different type of travel insurance because obviously you're not going to need it just for medical emergencies. These types of plans are known as travel major medical plans and are for people who are planning on traveling for longer than 6 months. Now, these types of plans are actually much more similar to traditional health insurance that you've had in the past. However, because they offer more coverage, they're generally speaking going to be more expensive. And there are some additional things that you should be aware of. Things like your deductible and your premium. Also, geographic coverage. It may not cover you in all areas of the world. And then benefits and exclusions. So you understand what benefits are, but there are also things that may be excluded. Generally speaking, these are high-risk activities, things like skydiving or bungee jumping. If you get hurt doing one of those, then your insurance may not cover you. And are you someone who's planning on skydiving or bungee jumping during your retirement? If so, let us know in the comments below. And there's another option to provide you with more coverage domestically, but also provide coverage if you're traveling internationally. And that would be a Medicare Supplement plan, also known as a Medigap plan. So Medicare supplement plans will fill in or supplement those financial gaps of Original Medicare. Because with Part A and Part B, there are separate deductibles, there are copays and coinsurance when you actually utilize your insurance, and there is no out-of-pocket maximum. Medigap plans will fill those financial gaps, and there are 10 different plans with varying levels of coverage. So these are the 10 plans available: Plan A, B, C, D, F, G, K, L, M, and N. On this side of the screen, these are the benefits, and these check marks indicate whether that benefit is offered or not, or in the case of Plan K and Plan L, how much of the cost of that benefit would be covered. Now, we've got plenty of videos that go into more specifics regarding Medigap and comparing the different Medigap plans, but for today, we're really going to focus on that foreign travel emergency. So the plans that cover that would be Plan C, D, F, G, M, and N. Now, a reminder, Plan C and Plan F really aren't being offered to new enrollees, so you would focus on Plan D, Plan G, Plan M, and Plan N. And our two number one recommendations would be G or N, which we do go into in other videos, which you can find in the description below. But if you are looking for more coverage domestically, then definitely take a look at these benefits as well to determine whether or not your plan that you're interested in is going to cover that. One of the great things about Medicare supplement plans is that even though they're offered by private carriers, there are still no networks. The same rules for original Medicare apply to Medicare supplement plans. So as long as your doctor accepts original Medicare, they accept your supplement plan regardless of who the carrier is. Also, there are still no PCPs required or referrals required. So these plans will allow you the ultimate flexibility whether you're traveling domestically or abroad. And another option is to forego original Medicare entirely and replace it with a Medicare Advantage plan. Now, the issue with Medicare Advantage plans is that they actually function more similarly to the types of insurance that you've probably had in the past. So you can choose between an HMO and a PPO. However, if you choose an HMO, you will need a PCP. You probably need to stay within your network's coverage area, which means if you're traveling out of state, you may not have coverage except in the case of a true medical emergency. And of course, with an HMO, you still need a referral to see a specialist. A PPO will offer you much more flexibility to travel domestically. HMOs will have in-network coverage only, except in the case of a medical emergency. And of course, PPOs offer you coverage in and out of network, giving you more flexibility. Also, as I said, with an HMO, a PCP or primary care physician is required, and that's not the case with a PPO. And then a referral is required for a specialist with an HMO, but not with a PPO. The only downside here is that usually HMOs will have slightly lower monthly premiums, and usually PPOs will have slightly higher monthly premiums. Now, as far as international travel is concerned, that's really up in the air, no pun intended. Medicare Advantage plans have varying different benefits. They simply must offer at least the same benefits as original Medicare. So some plans may offer international travel benefits and some may not. So make sure to read the terms of your plan carefully. So if you are going to go the Medicare Advantage route, when you're comparing your plans, over here on the side where it says Plan Benefits, you're going to want to see a green check mark next to where it says Worldwide Emergency. And it is a pretty common benefit, which is why you see it over here on the right-hand side. Even in this brief snapshot, what we're doing right now, you can see that the first couple of plans that we're looking at all offer worldwide emergency benefits. So do you have plans for travel in your retirement? Let us know in the comments below. You can also ask us any questions you may have, or you can reach us at the number on the screen. There is absolutely no charge for our services. As always, thank you so much for watching, and we'll see you next time. Bye-bye. As I mentioned earlier, here's that video comparing Plan G and Plan N. Also, please make sure to subscribe to stay up to date and make sure to like this video. We'll see you next time.